So Ken's legacy as a person was making difference in people's lives. And he loved being a physician. He really loved that, and he took that extremely seriously. Ken cared about saving his patients, but not just from the disease, making the patients better overall. And that included the family members. And there are few family members that became very close to us. And even after their loved ones pass away, they continue to engage Ken, they invite us for things, and many times we were the ones inviting them to do something.
Ken was in particular very impressed about how he much cared about the patient. For Ken was never, how good are we doing things? It's always, can we do better? What else can we do for this patient that we haven't done yet? Do you feel that this was your family member? Would you like to do something else? Is there something we're missing here that we can help this patient better? And that's what made Ken such a unique person. It was an example to everybody.
He believed in really mentoring. So many things I see now is how much some of his fellows or even nurses who worked with him, how much they saw both things. The importance of working together as a team with the focus of your patient.
He was really loved and regarded by patients, and it was that example that he provided to residents that made him such a great educator. He always emphasized also, despite being so busy clinically here at this hospital, that there was always a need to do research, to spend time, to look at a question and try to pursue that.
Ken was the heart of the hospital. So what he did was not just his patients, was not just his fellows, was trying to really have an impact beyond that. And not just the patients he touched, but with the mentoring, the patients that many people touched. So I decided to donate money to Kenneth Leeper's fund, because I think I wasn't the one who came up with the idea. But when they came up with the idea, I was thinking, how can I continue with this legacy? And I didn't know. And so when they thought about that, I thought, that's it. It's going to really continue to do what he always did and what he wanted to continue to do. That is mentoring people to be good, and not just good, to be great healthcare providers. And always to think about, it's not just us, we have to work together. It's not just the physician, it's just not the head of the ICU, it's working together. So I liked, because it's not just focusing on physicians, it's focusing on the whole team. So that's when I thought that it was a way for me to really help with his legacy.
The best way to honor someone's legacy is by contributing to a good cause that the person always wanted to pursue, which is the education of doctors, and to promote better care of patients, and also education of incoming residents and students, and respiratory care therapies.
Ken Leeper was dedicated to all the missions in our division, both patient care and teaching, but also very involved in clinical research. So the funds are going to support those missions with a particular focus on Midtown Hospital. So examples include the Ken Leeper Memorial Lecture, which will be held at that site every year, support for fellows engaged in clinical research or teaching activities at Midtown Hospital, but also non-physicians such as nurses in the intensive care unit, respiratory therapists, and other people with whom Ken had such a wonderful teaching relationship to help sponsor projects they would engage in, to attend regional or national meetings in their fields, and in general to make sure that Ken Leeper's name continues to be associated with all of the great teaching, patient care, and clinical research that happens at that site.
He continues to inspire me, and he motivates me, even not being here. Because what I do is patient safety in the federal level, I continue to look at that from my perspective here, but I look at Ken's perspective as a clinician. I look at Ken's perspective as, okay, what about the patient? What about the families? And I think it's helping me to do a better job. And I think that's his legacy, is to help all of us do a better job, not just with what we do, but also show me as an example for others that can then do the same.